I focused in my presentation on e-learning, not because that was the vast majority of what we do, but just purely for the limitations of time, and I know that there's some interest has been expressed in that. So, just to explain what training is like for a trainee of CONCECSA. It's the apprenticeship model, similar to what will be in Ireland. It takes place, as I said, from the biggest public hospital in the capital city to medium-sized private mission and district hospitals. Now, the training, only a certain amount of the training is done as e-learning. The idea is blended learning. You have your day-to-day work where you're doing surgery under supervision in an apprenticeship-based model. You have a number of mandatory short courses. You have to do a basic science course, a basic surgical skills course, and a trauma and emergencies course. So you have that component as well. Where the trainees were maybe lacking something in their education is the academic element, which is much easier to deliver in a big university teaching hospital, much harder to deliver in a private mission or district hospital. That's on the academic element. That's where e-learning comes in, but it's an adjunct to the practical training and the courses that they receive. It's certainly no more than an element, but we believe a very useful element of training. I hope that answers Professor Osmond's question. On the question of accreditation, it's CONCECSA that it delivers the qualification. Of the 9 countries in the CONCECSA region, there's full recognition of the qualifications in 8 of those 9. The 9th, Tanzania, there's a small issue, but that's hopefully to be resolved. So when you receive your FCS, Fellowship of College of Surgeons, from CONCECSA, you can put your name on the specialist registrar, and it's accepted in the country. Now, there isn't a component where trainees travel to Ireland or to another country, and that's by design, really. The whole raison d'etre of the program is to increase the training capacity in those 9 countries to a level whereby it's no longer necessary for trainees to leave. I can certainly see the use, especially from the trainees' point of view. Our program isn't looking to take trainees out of the area at all. And it was mentioned earlier on in the day that one of the big push factors for doctors and medical professionals to emigrate is the lack of training opportunities. We hope that CONCECSA and the collaboration program with the RCSI are helping to provide that. Now you can do, for example, you can become a pediatric surgeon in Malawi. You can train to become a pediatric surgeon in Malawi. You can train to become a neurosurgeon in Uganda. Some of these opportunities just weren't there before. And we hope that that's doing something to combat the brain drain in that case.